We are live.
Great. Hello, everybody. I'd like to welcome you to today's COVID-19 Vaccine Town Hall, where we'll have the opportunity to talk about the AstraZeneca Oxford COVID-19 trial. Just some housekeeping items. Thank you, Martin. You can go back to the next slide. You are able to ask questions all throughout the presentations. We will ask the questions of the panelists at the end of the presentation, but you can ask all along as any questions come up by using the app. So please, on your phones or on your computer, please go to www.slido.com, SLIDO, and enter the code that's on the screen at 73126. This will be on the bottom of every slide throughout. So if you forget or need to enter the code, there it will be, but it's best to go on the Slido app at the beginning of the presentation. So my name is Maddie Hasselman. I am the Assistant Dean for Academic Affairs at NYU Long Island School of Medicine. And I'd like to introduce our panelists and our co-investigators of this study today. Dr. Martin Backer is a clinical assistant professor at the NYU Long Island School of Medicine, and he is an attending in the infectious disease department. And Dr. Diana Badillo. Dr. Badillo is Assistant Dean of Diversity and Inclusion at NYU Long Island School of Medicine, and as well as an attending physician in family medicine. So Diana is going to start the presentation today. So Dr. Badillo, take it away.
Good afternoon, everybody. Thank you all for taking time out of your busy schedule and your workday to be here with us today to learn more about this COVID-19 vaccine trial, and most importantly, how you can help and participate in this very important endeavor. So I have here the agenda for today's town hall. We're going to go over the impact that COVID-19 has had on our lives, on our world, on our country. We're going to give you an overview about vaccines, how they work, and why they are important and essential to combat COVID-19. Dr. Backer is going to tell us a little more about the National Institutes of Health and the COVID-19 Prevention Network and their work towards creating a safe, effective vaccine. We're going to review clinical studies in general and the phases of clinical trials. And then most importantly, we're going to give you the specifics about the AstraZeneca Oxford COVID-19 phase 3 clinical trial that will be ongoing here, and how you can volunteer and participate in this trial. We can go to the next slide. So I want to start first by talking a little bit more generally about coronaviruses. So coronaviruses have actually been around for a very long time. They were first identified in humans as far back as the 1960s. And most of these viruses have been endemic, or what we call seasonal type viruses. Most commonly, they cause the common cold, which causes very mild respiratory type symptoms. You know, the regular colds that most of us and our children get during the winter months. More recently, however, in the past 20 years, there has been the emergence of more severe, more dangerous types of coronaviruses. In 2002, 2003, we had the SARS outbreak. And then in 2012, we have the Middle East Respiratory Syndrome outbreak. However, those two outbreaks were really more localized to certain geographic areas and never reached the pandemic type that we have now with the COVID-19 virus. On the left side of the screen, you see an image of the virus particle. Now, I know if you have turned on your TVs or watched the news at all in the past 6 months, you've seen this image over and over again. And I want to highlight this because what we see here, those red particles are called the spike proteins. And this is what gives the coronavirus its name, because corona means crown. So it gives the virus particle an appearance of having a crown around it. These spike proteins are important because these are what enables the virus to attach to and enter and infect our cells. And these are what we are targeting with our vaccines and some of the other treatments that are targeted for COVID-19, such as monoclonal antibodies. You can go to the next slide, please. So how does the coronavirus infect our system? Coronaviruses are transmitted primarily in respiratory droplets. This can be when an infected individual coughs or sneezes, or if you're in close contact, even with somebody who has the virus, and if they're not using a mask and they're talking, virus particles can be present in the respiratory droplets. And you see again that image of the virus particle with those spike proteins. So the respiratory droplets can enter into our bodies through our nose, through our mouth, which is precisely why wearing the masks help protect us. Once it enters into our bodies, it enters into our cells, usually either in the oral or respiratory cells, which are in our lungs. Those spike proteins attach to receptors on our cells and allow the virus to enter into the cells. When the virus enters into the cells, there's virus assembly. You see all those steps that are there on the diagram. But what I want to emphasize is that once this virus is released, our immune system comes into action. And we have these infected cells that can then be destroyed by our immune cells. And ultimately, with the outcome most likely and hopefully being the production of antibodies, these antibodies can help protect our system if you were to be exposed again in the future to the virus. Now, what I want to emphasize also is that in the creation of a vaccine, what we're trying to eliminate is the whole basically left half of this diagram. Once this virus comes into our cells and infects our system, this is when people develop symptoms, which most often are respiratory symptoms: cough, shortness of breath, the immune response with fevers and severe flu-like symptoms. However, there are some individuals who can be infected and have very minimal symptoms or no symptoms at all and still be able to transmit and spread the virus to others. If an effective and safe vaccine can eliminate that whole first process of getting infected and getting the illness, and really just have the second half happen where we have production of immune cells and memory cells that can combat and fight off this infection were you to be exposed to it in the future. We can go to the next slide. What I want to talk about here is really the staggering statistics that COVID-19, how it has impacted our country. This data was taken from the CDC website, just earlier this month, a few days ago. And you can see that across the country, the total cases have exceeded 6 million. Total number of lives lost, close to 200,000. And in the past few days, there's still been, over 200,000 new cases. This number is slowly declining, thankfully, but it's still a significant number. And I think what's really important to remember is that each of these numbers represents a human life that was either taken away too soon or significant illness that can have long-term, long-lasting consequences and really affect all those surrounding these individuals, their loved ones, and lives can be changed, forever because of this virus. I think most of us here, there's probably not anyone attending today that hasn't been touched by this virus, be it professionally or in their personal lives. So we all are very well aware of the health and health impacts basically of this virus. We can advance. Now this map shows the cases in the United States. Again, this was as of last month. For all of us here in New York, we know that New York was initially the epicenter in this country. And we had, the most cases initially, and NYU Winthrop in particular was considered a hotspot hospital on Long Island. But as you can see, it has not been limited to New York. The effects have been far-reaching across the entire country, with the darkest red colors representing states that have cases in the hundreds of thousands. Can advance. In addition to the loss of life and the health impacts of COVID-19, every other facet of our lives has been affected. There's been, as we know, the impacts on our healthcare system, the overtaxing and overburdening of our healthcare workers, the overtaxing of our supplies for life-saving equipment, our ventilators, our personal protective equipment. The economy has been significantly impacted, and this is probably going to have long-term effects as well. Tourism, entertainment, astronomical unemployment rates, the effects on trade. Our educational systems, as we're all very well aware, have been affected. And I think, it's important to remember that our most vulnerable populations are the ones who are really bearing the brunt of this. So our children who have special needs, who are not able to get the resources and and the services that they really need. Socially, there's been implications on our food supply, the meat processing plants, our farms. Again, our vulnerable populations, I can't emphasize this enough, our impacts on people that are already suffering in poverty or people that have mental illnesses. This has been impacted as well with the virus. And then, unfortunately, there's always been health inequities and health disparities in this country, but this pandemic has made those especially more prominent. Next slide. So who is considered high risk for COVID-19? We know now that people with certain underlying medical conditions, such as a weakened immune system for various reasons, people that may have already existing heart or lung conditions, people with obesity, these are all individuals who are at higher risk of contracting the virus and having a more severe illness in response to the virus. There are also individuals who are at greater risk of exposure to the virus by virtue of the jobs that they perform. People who live or work in elder care facilities, nursing homes, other communal type settings such as jails or prisons. We know that people who are over 65 or elderly persons, even, especially as you advance more in age, there are more risk of having severe consequences and higher risk of death from COVID-19. And then the last bullet again emphasizes that there are certain racial and ethnic groups and persons of lower socioeconomic backgrounds that have been more impacted by the pandemic and also in greater numbers, including our African American populations, our Hispanic or Latinx populations, and our Native American populations. So why are some of those minority groups considered higher risk? I mean, there's a multitude of reasons, and I'm going to highlight a few of them here. So access to healthcare and utilization of our healthcare system is one of the major issues and major obstacles that some of these groups encounter. So people from certain ethnic minority groups are more likely to be uninsured or undocumented, or even just not have adequate insurance. And they may have fear of accessing our healthcare system. In the clinic where I work, most of my patients, about half of my patients are undocumented and uninsured, and they're fearful about going to the hospital. In addition to that, there are language barriers and cultural barriers. As you're probably well aware, in the peak of our pandemic, family members, visitors were not allowed in the hospital. So these patients, oftentimes elderly, oftentimes not having English as a first language, were literally being left at the doors of the ED without a family member to be by their side through this process. There are other reasons as well. There may be lack of transportation. Many households have a single parent working, caring for children, and inadequate childcare or support to help care for those children should they be hospitalized. There's also the inability to take time off for work from many people. Many people don't have paid time off. And then the occupations, again, that put people at higher risk. Many people from minority groups are disproportionately represented in some of these essential work jobs. These are our nurses, aides, our home health aides, our transportation workers, the MTA, for example, which was so impacted by the virus. Our other frontline workers, our grocery store employees, our clerks, our cashiers, farm workers. So, these individuals will often work in these settings and they're not having the types of jobs that allows them to work from home or, be isolated and not exposed to many people during the pandemic. And then housing is a big factor as well. As I mentioned before, in my clinic, I have patients who often are uninsured or underinsured that are coming from communities with lower socioeconomic backgrounds. And these are not individuals that have the ability to isolate in a separate room in the house or use a separate bathroom, should they be diagnosed with COVID. These are not our celebrities who get to go to their summer home, their beach home, or their mountain home and quarantine, for 4 months. I've had patients who were discharged from the hospital with a diagnosis of COVID and, advised to quarantine for 14 days, but they go to a household where there's maybe 4 or 5 family members sharing a room or a small space, and oftentimes multi-generational family members. So there's a grandparent and a young child and parents all in the same area. That makes it much more difficult to stop the spread of this infection. So this brings us to why the creation of a safe and effective vaccine is so essential. And the populations that I was talking about in the previous slides, the high-risk medical populations and occupations, these are precisely the individuals that we need to protect and that we have an obligation to protect. And a safe and effective vaccine will do just that. Currently, there is no licensed or FDA-approved vaccine in this country, and there really is no, significant effective preventive treatments for COVID-19. Of course, all the use of masks and the social distancing has been effective in kind of stopping the spread, but it's not going to eliminate the virus. An effective vaccine is really the only way to guarantee a safe, sustained exit from these repeated lockdowns, to avoid shutdowns of our schools and to try to return to some sense of normalcy again. And if a safe, effective vaccine is created, this is going to have significant global public health effects, and it's something that we know is urgently needed. I want to go over just some basics about how vaccines work. This is a basic overview, and I want to talk additionally about, again, why they are so important. So vaccines teach our bodies to recognize a foreign invader, such as a virus. They send an alarm to our system to activate our immune system and those immune fighter cells. And then these fighter cells help to fight off the virus and make these antibodies, with the goal of eliminating or controlling the virus and preventing infection and or the development of disease. So it causes our immune system to respond by looking like the virus without ever causing the disease itself, without being, injected with the actual full germ or virus. And this is just a visual, again, of just exactly what we described. So vaccines are often a weakened form of the disease germ or a synthetic lab created form with copies of the disease in a solution. This is then injected into the body. Once it's in the body, it's recognized by the immune system, which activates the fighter cells, creates the antibodies, and then if the actual disease or germs are ever exposed to the body in the future, these antibodies will destroy them without having the infection or having a much milder course of infection. So vaccines have a long history of safety and efficacy, and they have prevented diseases in the past that have been dangerous or even deadly. And they work with our body's own natural defenses, our own immune system, to prevent this disease. There's a long history, again, of safety and very low risk of serious adverse events from vaccinations. I want to highlight here some diseases that have been controlled or eliminated in the United States due to vaccines. So smallpox, I think probably most of us here have never, seen this in real life aside from pictures and, images, but this was a very deadly disease that killed about 3 out of every 10 people that were infected. It caused significant disfigurement, and it was something that was completely eradicated worldwide thanks to vaccines. The last documented case was 1977. Polio as well was a severe disease that can cause significant disability and deformities. And in this country is something we're not seeing in individuals who were born here, thanks to our routine vaccinations. And this continues to keep our country polio free. However, other parts of the world still have active cases of polio, areas that don't have as robust a vaccination program as we do. And then the rest of the conditions, tetanus, diphtheria, also extremely rare thanks to vaccines. Measles, mumps, rubella, which can be very contagious and even deadly. This is something, again, that is very rarely seen in our country thanks to vaccines, although other parts of the world still have outbreaks. And then areas where people are opting not to vaccinate their children have seen outbreaks as well. And varicella, which was once, very common, 40 years ago, now is something that's a disease of the past, where our current generations of doctors and medical students will probably never even see a case in this country, at least. And I think what I want to emphasize as well is that it would be wonderful if we can add COVID-19 to this list. And this is what we're working towards with the studies of these vaccine candidates. I'm going to transfer now to my colleague, Dr. Martin Backer. He's going to continue with the presentation. Thank you.
Hi, good afternoon, everybody. Thank you very much, Dr. Badillo. Thank you, all of you who have taken really time from your very busy days to learn a little bit more about this very exciting clinical trial that we are a part of and we will be a part of. And as Diana said, we need your help to make this a reality and to find a vaccine that works, that's safe and effective against SARS-CoV-2 infection or COVID-19 that will allow us to move on to life more normal as we used to know it without the lockdowns or needs for social distancing, all the effects that she clearly went over. We are part of the COVID-19 Prevention Network, or COVIPN. COVIPN was formed in July of this year by the National Institutes of Allergy and Infectious Disease, which is part of the National Institute of Health, to respond to this global pandemic. It does this by using existing research networks that were already in place for different networks that were, for example, studying HIV vaccine candidates, and utilizes the structure, infrastructure researchers in place to allow us to launch large phase 3 efficacy and safety trials to fully but promptly evaluate these vaccine candidates and monoclonal antibodies as well. I anticipate that in our audience, we probably have a mix of some of you might be very familiar with clinical trials, but some of you might not be at all. So I'd like to briefly tell you what is a clinical trial. So it is a research study in people for interventions that have shown promise in lab and animal studies. Typically, when somebody's developing a product, whether it's a medication or a vaccine, it's going to start with lab studies in vitro. And if those are encouraging, it moves on to animal studies, typically with simpler animals to studies such as rodents. And then if those are again promising, it will move on to animals that are more closely resembling us, such as non-human primates or monkeys. The COVID-19 Prevention Network will be doing studies to find these safe and effective vaccines, or actually it's already doing that. And we at Winthrop are part of the NYU's Vaccine Center, which is a National Institutes of Health funded vaccine and therapy and treatment evaluation unit, which these have been in place for the last 50 or so years. And NYU has been more recently selected as a VTU. There's only about a dozen of those in the country. And we at Winthrop are part of this, and we're very excited to be part of this to help identify a safe and effective vaccine. There are different stages or phases of clinical trials, and these are typically followed in sequence to make sure we get a safe product. Phase 1 clinical studies typically involve a rather small group of individuals, several dozen up to about 100 volunteers, and is mainly going to be focusing on the safety of the product. Once those studies are completed successfully and they are reassuring, then an investigational product, for example, a vaccine candidate, can move on to phase 2 clinical study, which typically is going to consist of several hundred up to about 1,000 volunteers. And we're going to continue to build on the data gathering about the safety, but also going to start to gather more information that's going to tell us how likely is it to work as intended. Do we see evidence that the immune system or the defenses are being activated as desired, that anticipates that a vaccine candidate is going to protect us from the infection or the disease? If phase 1 and 2 are completed successfully, that's when typically it will move on to phase 3 clinical studies, where the key question is going to be, well, does it do what it is intended to do? Does it prevent infections, or at least, as Dr. Badillo was saying, markedly ameliorate the course of a disease in individuals that have been vaccinated should they become infected or exposed to the virus, as opposed to somebody that has not been vaccinated. It does that while at the same time building on gathering information on safety, and it's usually done on thousands of individuals. This particular phase 3 clinical study that we are a part of is aiming to enroll 30,000 individuals, mostly in the US, but also in Chile and Peru. So this is a study that we'd like to present to you, and that many of you might have heard from the news, which is the study of AZD1222 COVID-19 vaccine phase 3 clinical trial, which this is the AstraZeneca vaccine that many of you might have heard about. And I'd like to take just a brief pause here to acknowledge what some of you might have heard on the news over the last 24 to 48 hours. There's been some news reports that the recruitment has been halted, and that is correct. This is not unheard of in large phase 3 clinical studies. AstraZeneca is doing a review and evaluation of the trial this week, and hence there is a pause in the recruitment, but we anticipate that as soon as this is completed, the investigation, and it's found to be safe to proceed, this will proceed. Briefly, as I mentioned, this is not unusual. Clinical studies that are in phase 3 are enrolling thousands of individuals, and when an unexpected event happens, this is to be investigated fully to try to get more confidence on whether this was completely unrelated to the vaccine product that the investigational product or vaccine candidate that somebody was going to have regardless of their participation in their study, or whether it could be associated with the investigational product. So the vaccine that we will be studying is based on a weakened version of a common cold or adenovirus. It is not a human adenovirus, but a chimpanzee or monkey adenovirus, which is found to be very immunogenic, meaning that it generates good response from our immune system, and that our immune system or defenses are not likely to have been exposed to that virus before. So hence, it's going to be a better vector or carrier for the genetic information. This vector, which is the chimpanzee adenovirus, has been modified in such a way that is a non-replicating virus. That means the virus gets into our body just to deliver this message, which is the genetic material for the spike protein that Dr. Badillo talked about before, but will not reproduce in our system. So then, as I mentioned, it carries this gene for this spike protein, and then that gene is going to be expressed in our cells, and just enough to make the protein so that then our defenses are able to be exposed to the spike protein and learn how to recognize it should we ever find the real virus and fight it. The purpose of this study is to tell how well the investigational vaccine works at preventing COVID-19 disease and how safe it is. This is a schematic of the vaccine with the chimp adenovirus. And it is important to know, as I mentioned, that it is non-replicating, that it has been shown in multiple studies. This has been used for vaccine studies with other viruses such as MERS, HIV, hepatitis, different vaccines that are being developed and studying, and they have used already chimpanzee adenovirus with very good safety record and generating good responses from our defenses. This one in particular carries the genetic material for the spike protein. So this was initially developed by the University of Oxford, who has since associated with AstraZeneca to further develop and study this investigational vaccine. There have been very encouraging animal studies, initially with rodents and subsequently with non-human primates or monkeys. And then phase 1 and 2 clinical study in the United Kingdom with over 1,000 volunteers was very promising. There are currently at least 4 ongoing studies conducted in the United Kingdom, Brazil, and South Africa, and we are now enrolling in the United States as well. As of when I had this information for the slide, more than 5,000 participants had received at least one dose across the different studies of this vaccine candidate. According to our news media today or yesterday, the information suggested that it had been more than 10,000. In this phase 1, phase 2 study, which was published in the journal The Lancet, very prestigious medical journal, it was shown to be very safe in that only transient, local, and mild systemic reactions were seen. No serious adverse events were reported with this vaccine candidate, and for those individuals that received a second dose, the adverse events were less frequent and less severe after the second dose. There were no unexpected reaction, and the strongest immune response was seen in those that received 2 doses. To take home that point, 100% of the participants who received a second dose, they developed what's called neutralizing antibodies, which are expected to be predictive or have a good chances of predicting who's going to be protected by vaccine should they encounter the virus. It is important in terms of what adverse events were seen in this large phase 1/2 trial, mostly pain at the site of injection, fever either the day off or the next day, fatigue, and muscle aches were the side effects most frequently reported. So the study that we will be launching here soon, we're looking to recruit, as Dr. Badillo was saying, people that were at risk, that are at risk for developing infection and for developing disease. This is a study for adults, meaning age 18 or older, and people that by nature of who they are, what they do, where they live, where they work, might be at risk for getting infected. Certainly, we would love for nobody to get infected from now on, but the truth is that just by people doing what they do, for example, all of the professions that Dr. Badillo went over, people are still going to be exposed. And those are the individuals that we would like to enroll in our study, because we want to be able to show if the vaccine protects against the virus. And we want to show if it protects against disease as well. So that's why we need to recruit individuals who are at risk for getting sick from the infection, not only developing an asymptomatic infection. So those are all of the ones that Diana went over, older, more than 60 or 65. It's going to be people with underlying medical conditions, as long as they are stable, people from minorities, people living in multifamily homes, and the professions or occupations at risk. As I mentioned earlier, we're looking to enroll about 30,000 volunteers across the United States, of which somewhat over 1,000 in the NYU network and about 200 to 250 right here at Winthrop. This is a double-blinded placebo-controlled study that many of you might be familiar with what that means, but for those of you that don't, double-blind refers to the fact that us, the investigators and the volunteers, will not know whether the volunteers are receiving the active vaccine or a placebo being saline, so which is water with salt injected that it's not expected to protect or to harm in any way. And that way we can compare whether the vaccine protects and whether it causes any adverse reactions. The randomization, meaning people are going to be assigned by chance to either vaccine or placebo, is going to be 2-to-1, meaning that volunteers are going to be twice as likely to receive the vaccine than they are of receiving the placebo. This is a little bit what the scheduled visits are going to be like. And again, we really appreciate people volunteering for clinical studies. Otherwise, we would not be able to come up with safe and effective vaccines that are able to return us to a sense of normalcy. It will imply about 7 scheduled visits to the vaccine center right here at Winthrop. And at the first visit and the second visit, 1 month later, they will receive the injection of either the vaccine or placebo. At both visits, they will be receiving the same thing, vaccine or placebo. And then they will have follow-up visits at 2, 3, and 6 months. And after the first 6 months, only 2 more scheduled visits at 1 year and at 2 years. Now, in the past, when I was presenting about this and people were hearing, they were bringing up the question or wanting me to clarify, when I say 2 years, does that mean that we're not going to know for 2 years whether the vaccine works? No, it does not mean that. That is the period of time for which we will follow participants very closely to identify any adverse reactions, and we will gather information and we'll have the visits described there. But as soon as there are approximately 80 people in the study that get sick, then there's going to be an unblinded group that will be looking at precisely whether there is less people, significantly less people in the vaccine group that develop COVID-19 than those in the placebo. And as soon as we're able to demonstrate that there is protection, as long as there is no red flags for safety prior to that, that's when we're going to be able to share that information that the vaccine does indeed work, or if there is no difference, again, that information would be shared as well once there's confidence in those results. Throughout this period, there will be weekly contacts between the study team and the volunteers, whether it's by phone, email, or texting. And in addition, volunteers are expected to check themselves and also when they're communicating with the study team for any signs or symptoms suggestive that they could be developing infection with the COVID-19. And if they do, they are going to be asked to come in to the center to be evaluated. They would get a nasal swab to make the diagnosis. They would get blood work and get a complete physical exam and evaluated for any care that might be needed. At each of those visits on the screen right now, also blood work is anticipated. As I mentioned, participants will be monitored throughout the duration. And if they have fever, shortness of breath, or difficulty breathing, they will be asked to be evaluated promptly. If they have any of the other symptoms that you might be familiar of COVID-19, such as loss of taste, loss of sense of smell, aches, or diarrhea, vomiting, if those are present for 2 or more days, that's when participants are going to be asked to come in. So if you or somebody you know or somebody you refer for the study reaches out to the study team, to us, we will be asking personal questions to be able to determine whether the study is a good fit for you. And if you sign up through the registry that I will be sharing the information at the end of the presentation, it is important for me to mention, that's another feedback that we received, that you might not be contacted or you might not be contacted right away. We're going to be starting to contact those that seem to be a better fit for what the study requirements, where we have the inclusion and exclusion criteria that say who is a good candidate for the study. But you might not hear right away. If you have concerns, you can always reach us by phone or email that I will share with you as well. As all clinical studies, there is a very careful process of informed consent where you will be given full detail of what the study entails, what it means, what saying yes, what you're agreeing to before we enroll any volunteer. This is a little bit what will happen during the study that I think to a large extent we went over, but it is worth mentioning that volunteers will not be exposed to the SARS-CoV-2 virus or the virus that causes COVID-19 as part of the study. In the lay media, there were reports that there were considerations about doing challenge studies. Challenge studies typically will enroll very young and very healthy individuals and vaccinate them and then see whether the vaccine protects them by exposing them specifically and on purpose to the virus. This is not what we are doing. We are just vaccinating people and asking people, or vaccinating or giving placebo, asking people to continue to be careful and mindful and do everything that's recommended for everybody, meaning the social distancing, the wearing the mask. But we just anticipate that by doing, what they're doing in their daily lives, some people are going to be exposed, but we won't be exposing anybody to the virus. These are some questions that we hear about frequently. Is there a cost to be in the study? No, there is no cost to participate in the study for the participants or volunteers. We will reimburse volunteers for their time, travel, and inconvenience. There's some reimbursement there, since we do appreciate taking time from their busy schedules. Volunteers can withdraw at any time from the study. So giving informed consent, and even though the plan is to be part of the study for 2 years, if for whatever reason somebody changes their mind, they are entitled to. That's important for somebody that's not familiar with clinical trials, that they know about them. And the study may or may not benefit a volunteer, but it certainly, we hope that it will benefit our community getting an answer on whether this vaccine works and protects and is safe. So bottom line, in terms of next step, we need you. Some people in the audience might be good fits for the study, or the study be a good fit for you, and you can make a difference in saying, hey, I helped discover a vaccine that protected us from this awful COVID-19, and that was, the worst pandemic in a century. So you can make a difference by doing that. Some of you might be clinicians that might be able to refer, or might know somebody that you could refer to our study and help spread the word. Talking about spreading the word, throughout our campus, there are several of these flyers that I have already seen them, and those have details of who we're looking for the studies and how to contact us. And that information, I think, is more clearly shown right here in the yellow box. The preferred way is the registry, that website right there. You can go, they're going to ask you personal questions, but these are kept private, just to see whether the study is a good fit for you. There's our phone number and our email address. On the left, that's some of our resources for you to read more, that we use to put together this presentation. And again, we encourage you, if you haven't asked questions yet, you can go right now to slido.com, enter, oh, I'm sorry, this one still has the old code. There it is, 73126. We had another town hall yesterday, and that was a code from yesterday. So the current code is 73126. Thank you.
Thank you very much, Dr. Backer and Dr. Badillo, for that presentation. We have had questions come in throughout, so I'm going to ask to both of you some of the questions that have come in. And again, to the audience, please continue to ask questions to the Slido app if you have any questions to ask. So one of the first questions that came in was a question regarding the virus itself, the vaccine itself. Is this a live vaccine? You may have answered that without, but if you could reiterate whether this is a live vaccine or not.
It's a great question. It could be a little bit of semantics. I would say for all purposes, it's not considered a live virus vaccine. First of all, certainly it's not a live coronavirus vaccine. There's just the gene for the coronavirus spike protein. And even for the chimpanzee adenovirus, this is non-replicating. So I think for all purposes, it should not be considered a live vaccine.
Another question, can the attenuated adenovirus cause any illness at all?
Great question. I don't expect that to cause an illness in that. Again, this is non-replicated and it's non-human, and even the normal adenoviruses just cause like a cold, but this is chimp and it's non-replicating, so it wouldn't. The vaccine, as we mentioned, can have adverse reactions that can feel like an illness for the day that you receive the shot or the day after, such as, could be fever, could be muscle aches, and things like that for the day of the vaccine or the day after, mostly is what's being reported in the phase 1 and 2 clinical studies.
Great, thank you, Dr. Backer. Another question was, if you had received another adenovirus vaccine, would the COVID vaccine and the adenovirus still be fully immunogenic?
I'm sorry, could you repeat it, please?
Sure, absolutely. It says, if you have received another adenovirus vaccine, would the COVID vaccine and the adenovirus still be fully immunogenic?
Great question. We would need to see exactly which adenovirus vaccine somebody might have received to see if this one is the same. There aren't that many people that are likely to have participated in a trial with an adenovirus vaccine. None of the currently licensed vaccines are adenovirus vaccines, but if somebody has been part of a trial, for example, an HIV vaccine trial or another, we would need to look into those details. But if it's there's different even chimpanzee adenoviruses, so it's likely still going to be very immunogenic. If it was the same one, there could be some chance that there would be decreased chances, so we would look into that in detail.
There's two questions relative to the AstraZeneca trial, and I know you touched on this briefly, but I'll ask them both, and maybe you could talk about the halt in the trial. The one question was, is the AstraZeneca vaccine that was withdrawn because of complication, is this the vaccine that we will be using? And then the second, really, I guess, part of the question was, what was the side effect and the reason for the halt in the trial?
Right, they are both great questions. The first one, I would say, yes, that is the vaccine that we are presenting about, the AstraZeneca vaccine. There's currently just one AstraZeneca vaccine. There are multiple COVID-19 vaccines that are being developed by different manufacturers, and the COVID Prevention Network that we are a part of is working on several different vaccine candidates. And being part of the NYU Vaccine Center, this one is, the first one of possible multiple COVID-19 vaccine trials that we might participate in. Currently, it's the only one that we are launching, so it is the same one at this point. In terms of what are the side effects, we know what's been reported in the lay media, but we don't have formal notification from the manufacturer, from the sponsor, AstraZeneca, about the details. Our understanding is it's still under investigation, and once the investigation is complete, they will certainly communicate. And just to reiterate something that I mentioned before, because they said, okay, what was the complication from the vaccine? Just as a general point, the fact that there is a halt or that they are investigating if there was somebody that got ill or had an adverse event during the trial, the fact that there is an adverse event, it doesn't necessarily mean that the adverse event was due to the vaccine. Again, you're enrolling thousands of individuals, and somebody, could have, something bad happen to them, and we certainly regret that, but that doesn't mean that it was necessarily due to the vaccine, but precisely because they are investigating that, there is an enrollment pause at this time during the investigation. But that should just reassure all of us, I think, that we are not rushing to come with a vaccine. Yes, we are trying to not waste any time and move expeditiously, but still evaluating very thoroughly. And this shows that safety is a top priority for everybody involved in this process.
And I would just add that, I know the question said that is this the vaccine that had been withdrawn? So it's not that the trial has been stopped. It's just basically been put on hold as far as enrollment until this investigation is complete. And there's a independent data and safety monitoring board, independent from the FDA and from the drug company, that does an investigation, again, to make sure that safety is really the priority.
Great. Thank you both. Really appreciate that. Just a couple more questions. There's a question here that if there are serious side effects or side effects that come from this trial or really any clinical trial, who is responsible for the medical bills?
Great questions. I don't have the perfect answer. Before we get the consent, I would look up. In general, I think for these kind of things, there might be a common fund for these things, but I don't feel confident answering with certainty at this point. But before anybody gives informed consent, we would clarify that. Dr. Mulligan, who's the director for the NYU Vaccine Center, is a tremendous resource and could help me clarify any of these questions.
I think also it's important to emphasize that while the participants are in the trial, they'll be monitored very closely. They will be keeping a symptom diary, keeping track of any symptoms that develop. Anything that does develop the research team will be notified right away. It would be addressed. So, while you're part of the trial, the research team is going to be really coordinating your care and making sure that any type of issues, concerns, symptoms are thoroughly addressed.
Okay, just a couple more questions here. One question is, can I get COVID more than once?
So I'm sorry, I'll just start and I'll have Dr. Backer continue. But you know, there have been cases, you probably also heard in the media, of people that have been infected more than once with the virus recently. And you know, I think we don't have a perfect answer still as to when someone gets infected and it has antibodies, how protective or for how long those antibodies are present, and whether they offer protection or for how long they can offer protection. And so I'm sure you will have some more to add to that, Dr. Backer.
No, I totally agree with you, what you said, Diana, and thank you for that. They seem to be very rare cases of reinfection. And it is important to know that just because somebody has a positive PCR or the nasal test more than once doesn't mean that they have been reinfected. There's been very rare reports that suggest that reinfection might be possible, but seems to be probably rare. But we're still learning more and more about this virus.
Okay, I just have two more questions here, and then I think we'll be right on target to end. One question is, what happens if a different vaccine is approved than the one that we're trialing now, and I've already received doses in the current trial? Is this dangerous?
Great question. Thank you for that. No, so it's important to note that somebody that's participating in this clinical trial that we are presenting, we are going to ask that you don't participate in another study of another investigational vaccine at the same time, or investigational drug to prevent COVID-19. But if a product is licensed, has been shown to work, then by all means, you will be allowed to get that vaccine while still participating in our trial. And it is not expected to be dangerous. In general, vaccines have a history of quote unquote getting along with each other very well, and very unlikely to be detrimental in any way. The fact that you got this investigational vaccine to get another vaccine against COVID-19, and that would be permitted.
That's great. Thank you very much. And just one last question. Anybody else that has any further questions, if you want to enter in the app, otherwise this will be our last question. The question is, if the vaccine is designed to stimulate the immune system, is there a chance that someone who is vaccinated will become very ill from overstimulation?
Again, another great question. And there were some of the studies with the SARS vaccine candidates that were first, they had started studying, but then of course SARS disappeared, so funding for that dried out. But there were some studies suggesting that after vaccination, there could be an exaggerated response of the immune system and make the disease worse. This has not been observed in the much larger trials that have been done to date with the vaccine candidates for COVID-19. So while theoretically that's something that could occur, nothing close to that has been seen so far in the studies.
Great. Okay, if there's no more questions, we want to thank everyone for attending today. We really want to thank you for your help in understanding what these trials mean to the school, to the health system, and appreciate you listening. If you have any questions, please contact us at any time. The Vaccine Center email and phone number is listed, and is available on any of the flyers you may have received. So thank you again. Thank you, Dr. Backer and Dr. Badillo, for your presentations today, and have a great day.
Thank you.
Thank you very much.